and welcome into Your Health. You know, if you look at the news, we find out that there's shortages in the area of the medicine profession. Today, we're very fortunate to have with us the Dean of the University of Alabama School of Medicine, Montgomery campus. Right. Very important point, Montgomery campus. Right. Dr. Louis Lambiase. Dr. Lambiase, or Dean Lambiase. So good they wear two hats.
That's right.
Gives you a stethoscope, too. And obviously, you've been here now almost 5 years.
Yeah. Mm-hmm.
And you've done a wonderful job with the campus.
Oh, thank you.
You've really brought it into the community and made, you know, it used to be, what's that? And now you're putting a face on a wonderful institution.
Thank you.
And
well, thanks a lot for having me, Jack. I really appreciate it. And yeah, it's really great to be able to talk about, our campus and what we're doing here.
You know, we talk about the fact that one of the big goals in Alabama is the person go to school and then leave Alabama. What you're doing at your clinic or in your school here is you're showing them a good face of Alabama. And you mentioned that some people that have gone through, at least 10 of them are still here.
Yeah,
which is great.
Well, I mean, that's our goal, right? The UAB School of Medicine's goal is to train people and to deliver a workforce for healthcare in Alabama for Alabamians. And so, the Montgomery campus was founded because there's a recognition that all of that training can't happen in Birmingham. And not only that, we have to have a place to train our local students as well to be doctors. And really, our goal always is to train them up, make sure they're really, really good, and then have them stay in our community. And we're starting. The Montgomery campus was really founded. Depends on how you count. The first students were here in 2014, and so we're really starting to see that happen. The internal medicine residency has been here for 50 years, and so a lot of the doctors and specialists in internal medicine are from that. So yeah, we would like to train them, make sure that they're excellent, and then have them stay. And
you're in the second year now of the psychiatry residency.
We're just about to start the second year.
And we brought an old homeboy home.
That's right.
That's right.
That's right. Dr. Rutland, who is a Montgomery native, went to high school here, and then went to medical school, and is from our campus. And then he went off to train at some place in Connecticut, Yale or something like that. Right. But then he came back to Alabama.
One of those rah-rah schools.
Whatever. Yeah. And then he came back to the important place, which was here in Montgomery. And he's our head of psychiatry, and he stood up this psychiatry residency. And so we're really pleased. And we actually, what's nice is we're hopeful that we'll know in about a month, but we're hopeful that one of our students is actually going to be in our second residency class. So one of the medical students is then going to be a resident in psychiatry, and then hopefully 4 years after that, he'll be a faculty member in our program. So it's a big cycle, but it's really been great.
And my doctor always tells me that he's the gatekeeper. He's a primary care internal medicine doctor.
That's right.
And like you say, your internal medicine program is top notch.
Yeah, they're really great docs, and I'm proud of each and every one of them. And they see patients right here in Montgomery. And as a matter of fact, they have availability. Just put in a plug. We could see you probably within a week.
We need to let people know that because a lot of our audience, they're getting older, and their doctors are getting older at the same time and retiring.
Yeah.
And they need somebody.
Yeah.
And we've got them here.
Yeah, and they do a great job. Really, really, really super. And so, and like I said, they have availability. And I think that this is important too, right? If it's really important that we train physicians in our community so that we have physicians for the future. So a lot of people come up to me and they say, how do we support this? And I think the way you support it is by making sure that your doctor teaches. And so, so if you go to the internal medicine clinic, you're supporting medical education in our community, you're supporting Montgomery, and in a way, you're supporting our future. So not only are you taking care of yourself, not only are you going to a great doctor, not only is there accessibility within the next week or so, all of the above, but you're also helping the future of Montgomery by going to people who teach. I always say, if your doctor doesn't teach, you should ask them why not.
Amen. Good thing to do. Well, Dr. Lambiase, you've done a great job in your short tenure here. 5 years.
Yeah.
And you keep up the good work
Thank you.
because it's very much needed. And as we mentioned earlier, if you're looking for a physician, go to the website and you can find whatever you need to get yourself an appointment pretty quick. We'll be right back right after this.